Right now, deaths due to COVID-19 in the U.S. have topped 180,000. We've heard about what happens, though, if someone tests positive and some of the scary situations they and their loved ones may have to deal with. But what's next for those who overcome the virus? Idaho News 6 reporter Nicole Camarda spoke with one woman about her experience dealing with COVID-19 and her recovery. That's in today's Finding Hope.
I had heard a lot of things about it, but I was pretty confident in the fact that I'm pretty young and healthy.
Teresita Duran was living life as normal, going to work, coming home, and repeat.
We kind of went on lockdown. I kept going to work because I work at a bank and it's kind of essential.
As the weeks went on, Teresita says she started working with more customers. She says she thought everything was fine until she woke up one morning and noticed a change.
I made my coffee as usual, and I usually get that strong coffee smell, like that, like deep, like coffee smell. And I didn't get it. I was like, oh, maybe this is old coffee. Didn't really pay much attention to it. Made my coffee like usual. I felt fine. I headed out the door, and I was on my way to work, and I took a sip, and I couldn't taste anything. It was so bizarre. It was hot. I could feel the sensation of it being hot. I couldn't taste anything.
She says she started to notice other symptoms such as body aches and chills, which prompted her to get tested for COVID-19. A few days later, she got a call from Southwest District Health telling her she tested positive.
When I would inhale through my nose, the air would feel really cold, even if it was like I was outside and it was hot. When I would breathe in through my nose, it'd be like a cold sensation. And then from that, I kind of just started experiencing more of like the coldness in my back, which I just kind of like, at first I kind of was okay, it's just like body chills and it's just like coldness on my back. But then like the body chills went away and I would still feel that coldness.
Teresita says she was so cold that she had to use a heating pad to warm herself up.
I had never felt that type of cold before, because I've had felt cold in my body. I felt like all types of coldness, but I had never felt like that internal coldness. And it's so hard to describe because I had never experienced it before. So it's not like, I don't think it's something common. People know like what that feeling is like. That was probably the point where I was like, this is kind of scary, because it was like no one knew what this disease or this was capable of.
Now recovered 4 months later, Teresita says she still feels that coldness in her back a couple times a week. I spoke with a doctor at Regents Blue Shield of Idaho who says that these long-term effects are still being discovered.
We just don't have a full picture of what this virus can do to people. And there's a lot to flesh out there, but it's not unusual that would be a symptom because, again, this is relatively new and we're still learning about it.
Nicole Camarda, Idaho News 6.
Joe Battalato also says other patients have reported feeling fatigued and have a sort of brain fog while in the recovery process.